New study: 41 million people in USA can't afford basics. 1 in 5 working families has a tough time affording basics like shelter and health care, while earning too much to qualify for food stamps or Medicaid. Approximately 1 in 5 working American families can't even afford basic needs anymore, and many scrape to get by on insufficient income and government aid. Policy researchers conclude in a report many of these workers earn too much to qualify for work supports such as Medicaid and food stamps, while their employer-provided health insurance doesn't even cover enough of their basic medical costs. According to the report by the Center for Economic and Policy Research and the Center for Social Policy, we no longer live in a world where having a job means you're automatically able to make ends meet. Our work support policies need to be updated to support the millions and millions of families with earners in bad jobs. About 41 million people in working families can't afford such basic necessities as health care and housing, according to the report. The study, which examined conditions in 9 states in the District of Columbia, found that government programs close about 2/5 of the hardships gap, a measure of the difference between a family's income, including all aid programs and the local costs of goods and services. Families fall into the hardships gap because the low wage labor market provides meager pay and few employment-based work supports for low and moderate wage earners, the report noted. The report's authors recommend steps such as focusing on better wages and mandates for employers to provide employment-based benefits, and simplifying the eligibility criteria and application requirements for work supports. Public policy is not caught up to the reality that even working families may need public work supports. The authors wrote, "Without public work supports, they and their families go without health insurance, adequate child care, safe housing, or other necessities." Many of those in the hardships gap earn too much or do not meet other eligibility criteria to qualify for work supports, even though they are low income. In 2005, about 1/5 of workers were in bad jobs, those that paid less than the median wage in 1979 in inflation-adjusted dollars, and did not even offer health insurance or retirement plan, according to the report. Employer-based benefits are good for people with access to them, but most low-wage workers aren't offered or can't afford them, the report said. While workers with moderate or high earnings commonly receive health insurance, paid time off, and retirement plans, low-wage workers most often do not, the report noted. The median monthly hardships gap for families in the states covered by the report was $1,524. After work supports, that gap decreased to $855. Therefore, the typical family with a hardships gap sees a saving of about $8,000 in work supports. However, we find that many of the low-income working families are either ineligible for work supports or do not receive the supports to which they are entitled, the authors wrote. Part of the problem is that the work supports don't reach all who are eligible due to a very complex registration process and a lack of resources or money. What kind of deal is this? Not good.